his or her life to medical profession. You all are in a very noble profession, but I know you all are going through a very, you can say, high tide, low tide, high tide, low tide. Because when you entered into this profession, you always thought that okay, the life is done, everything is done, sab ho gaya. But now, as the time is passing, and you people are in the, you can say, penultimate stage of your life. Why I'll say penultimate, because you most of you are still undergrads. बड़ा difficult phase होता है वो. So I'm here to answer you for all your questions and to share my experiences with you so that you can use them in your life and try to get a solution to some problems. Saurabh, you can start.
So, hello everyone. So today we have got Sir with us. So let us start the session today. So, sir, many have the doubt which year in MBBS is the best to start surgery. As you know that it's a subject of fourth year, but we start studying it from second year itself. The exams are conducted in college from second year only. So, which year, according to you, is the best to start surgery?
That's a very good question. Also, and I have created that poll also for you. Remember, you have to start surgery early in your life. Why? Because when we talk about surgery, starting surgery in the first year, I would say first year is not the right year because you don't know anything about the anatomy. So, agar you're starting it in the first year, it's too early and it might become complex. I would not say it's not you cannot understand, but it would become a bit complex because you don't know anything about anatomy. But when you drop it in that honeymoon year that you have, that second year, okay, we'll relax and we'll enjoy our life, और उसके बाद हम start करेंगे. The problem is by the time you read Opta, you read PSM, you read ENT, and you go into your final year and start, you can say, start preparing for surgery. The time is that is left is very less, and at that time you're struggling with your anatomy concept. So what I would say, the second part of second year, the second half of the second year is the ideal time to start in surgery. All the people who are passionate about surgery are the one who have read surgery, and to read surgery you have to give sufficient time, and that is the time, that second part of that, you can say, the second prof that you have, later part of that is the ideal time to start, because you have now have an orientation about the pathology also. So वो बहुत help करती है to understand the macro and the micro concepts of the surgery. So surgery के लिए anatomy तो important है, pathology is also very important, because otherwise you will not understand कि भाई if you are reading suppose LCIs, आपको पता ही नहीं कि lobular carcinoma in situ होता क्या है, and then you start mugging up the subject, and that is the time you develop aversion from the subject. So I would say the second half of the second year is the ideal time.
Thank you, sir. So, next question, which many have, surgery is a very big subject. So, how to approach surgery in general? What should be the approach of a student?
Let me tell you, surgery देखने में बड़ी big, it seemingly is big, but it is not. Why? Because the concepts are very simple. When you talk about surgery, you don't have to mug up anything. So, like if I am a surgeon, I know how to do resection and anastomosis. I don't have to mug up those concepts every day. I know that this is the crux, this is the basics. So, when we talk about surgery as a big subject, you should start reading it, you can say, precisely from the second prof. And when you start reading precisely from the second prof, you start developing a story based, you can say, image of the surgery. आपके साथ क्या होता है कि why you feel it tough, why you feel it lengthy, because you try to connect the disease and you try to connect the disease with the surgery, but you don't know the gross etiopathogenesis behind that. You don't know the basics. You start struggling with the anatomy by the time you're in the, you can say, fourth prof. That's the part two of your, you can say, phase of your life. So वहां पर जाते जाते वो टफ लगने लगती है. लेकिन अगर आपको वो उसका, you know the intro, basically the intro is surgery of the surgery's anatomy. So when you know the intro, when you know the pathology, so वो जो story building concept होती है ना, वो timeline based approach होती है. It becomes very easy. When I was in MBBS, I had studied the Bailey and Love at that time. लेकिन अभी क्या ट्रेंड हो गया है, नो वन स्टडीज बिलियन लव, यू पीपल स्टडी द इंडियन बुक्स. आई एम नॉट सेइंग द इंडियन बुक्स आर नॉट गुड, but if you see the chronology of these Indian books, they're more like, okay, you have a disease, we have 10 points regarding that, we have a surgery and surgery is being explained. So they believe that you know everything, and that is how you start finding it lengthy. So length is actually, if you go retrospective, length is just because you don't know the subject. If you know the subject, if you know the idea behind the subject, you'll always find it easy. तो सर्जरी को इजी या टफ परसीव करने के लिए यू नीड टू हैव द कॉन्सेप्ट्स. अगर कॉन्सेप्ट्स अच्छे हैं, you'll find it short, you'll find it crisp. But if the concepts, the base is not good, you'll always find it large, lengthy. This is why it is seemingly tough for a lot of people.
Okay, sir. Sir, I would like to ask, is studying surgery for the professional exams and for the competitive exams like NEET, PG and INICET, are they different or the same?
This is where the intelligence comes. देखो क्या होता है कि lot of you believe that I will make mnemonics, I'll make you can say a point wise approach, and I will mug up these, and these are the points, these are the PYQs, these are the questions which have been asked. So let me mug up 10 points and then just vomit it, and this is going to help me in my NEET PG or INICET. This is wrong. This is wrong. Remember, when we talk about surgery as a subject, you study it only once. दोबारा पढ़ना ही नहीं है. You read it for final year, you read it for your life, you read it for your prof, you read it for your surgery residency. But just surgery is not going to change. Calots is not going to change. आपको लगता है कि surgery is different for the MBBS students, surgery is different for the PG students. ऐसा कहीं नहीं है. The only difference between you and them is that you study, you don't practice. They study and they practice. And that is why you start getting or widening that gap कि यार उनको तो बहुत कुछ आता है. उनको बहुत कुछ इसलिए आता है because they are conceptualized. And that is the same thing. If you talk about me, now it's more than a decade I have been teaching, and I have been teaching to everyone, rank 1 also, rank 2 also. I've been into this industry and I know everyone. And do you know, take my words, toppers are the students who have good concepts only. Why in final year, why with internship you are able to put a good rank? Because you don't know a lot of things, but whatever you know, you know it in a conceptual way. So वो जो प्रैक्टिस है ना कि यार मैं निमोनिक बना के रट लूंगा या रट लूंगी या आई विल मग अप द थिंग्स, दिस इज नॉट गोइंग टू वर्क. रिमेंबर, स्टडी द बेसिक्स, and from those basics the questions are created. So this is what is very 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 important. So I would say there is no difference between INICET, between NEET PG and your final year exam, but the only difference is there you have MCQ. So you need to learn that art of segregation, and that is how you develop that, by practicing with test series and MCQ based questions. In the second, in context to the, you can say, university exams, you have to write the question, and when you know the concept, then only you will be able to draw the, you can say, timeline. You have to draw an algorithm, you have to frame the answer. That's the only difference. Lekin the concept is not going to change. Rather, it is only once that we study surgery. So चाहे वो एग्जाम के लिए हो या प्रॉफ के लिए हो या फिर वो आपके यू कैन से INICET और नीट PG एग्जाम्स, कॉम्पिटिटिव एग्जाम्स के लिए हो, it is not going to make any difference. You study surgery only once. Like you say, no, you live life only once. That's the same thing. You study surgery only once. आप MBBS लेवल पे भी वही पढ़ोगे जो आप इंटर्नशिप लेवल के बाद, आप नीट PG क्रैक करने के बाद आप MS रेसिडेंसी में पढ़ोगे. द रीजन that they have a difference is like they practice. So ऐसा कुछ भी नहीं है, there is no difference. हाँ, yes, once your final prof is done, now you have to emphasize more on solving MCQs. So ये गलत आर्ट है कि फाइनल ईयर में you are giving 70% of your load to solving MCQs, thinking that okay, I have to pass an exam. First of all, conceptualize it, read it, prepare it, and then appear for your university exam. उसके बाद you have 1 year to just divert yourself now. Same content will fuel your NEET PG also, will fuel your university exams also.
Thank you, sir. Sir, you were telling us about the books. So, sir, many have a question that uh, in MBBS, what books should they follow for surgery? Or are the lecture notes, whichever source they are following, are they enough for their professional exams as well as the competitive exams?
Let me tell you, I have a bit of biased approach in this. First of all, there is no one who can replace book, because try to understand, the lectures are always made in a way that we have a time bound concept. So हमें पता है कि in 60 hours or 80 hours we have to complete the lectures, and therefore I have to cut short the things. I will try to explain the things, but not beyond a scope. So remember, you cannot replace the textbook study. It has to be your base. Now, when we talk about the lectures, if you see the conventional lectures, they are framed in such a way that it is a point based, you can say, learning. So जो लोगों को लगता है कि यार ऑनलाइन रिसोर्सेज से या जो इंस्टीट्यूट्स हैं जो थोड़ा बहुत करके पढ़ा रहे हैं, that's okay to polish you, but they cannot make your base. No, let me tell you one very important thing. Like if you talk about Surgery Dada, also that the app that I have, in that I have a NEET PG segment, but that NEET PG INICET segment is totally denoted in a way that okay, someone knows the content, he or she wants to prepare it for NEET PG, and that is how the things are. But if someone will ask me, okay, is this sufficient for my everything? I would say no. It's sufficient for your exams. But to make a concept, to create, you can say that volume in that subject, you have to have a textbook support, and that is why I have launched that all those books like the bedside clinics and those algorithm based books. But yes, when I talk about my residency teaching, जो मेरी residency, that Dadagiri series one that I have taught surgery more than 140 hours, 140 घंटे, and still some part of GIT is left and some part of general surgery is left. Because that is the way. Surgery is vast. If you ask me to cover everything, it will take time. So not everyone has that time window. And that is why I said, start it early in the second year. Because if you start at that time, you'll find sufficient time to revise it again and again. बच्चे अगर आप कोई चीज रिवाइज नहीं कर सकते ना, is useless. So that is the time when you start mugging up or getting in those traps. Okay, I will go to you can say I will go to a conclave where they will have 5 days of revision of 19 subjects. I'll mug up that, and that is again you fall in more and more trap. So remember, no one can replace the textbooks. They are the crux. And when we talk about textbooks, students try to read Love and Bailey. It's a beautiful book. लेकिन वो यूजी के लिए है, वो पीजी के लिए नहीं है. सो लॉट ऑफ यू हैव अ यू कैन से मिथ ना कि लव एंड बेली इज इट फॉर पीजी स्टूडेंट्स. नो बच्चे, पीजी आज की डेट में कोई भी लव एंड बेली नहीं पढ़ता, डिस्पाइट द फैक्ट इट्स अ गुड बुक. सो स्टार्ट रीडिंग लव एंड बेली, एंड देन वट एवर ऐप यू आर प्रेफरिंग, किसी भी ऐप से पढ़ रहे हो, प्रिफर अ टीचर, चूज अ टीचर हु कैन एक्ट लाइक अ मेंटर. बच्चे, दिस इज अ राइट टाइम, ट्राई टू अंडरस्टैंड, move away from that mnemonic based learning. वो जो रटने का concept है, move away, because you are destroying yourself. Delay your selection by 1 year. Remember, delay your selection by 1 year, but don't fall into that trap, because once you move out of the, you can say, this exam based regime, and when you complete your things, and if you don't have that confidence of concepts, your eyes will never see, your brain doesn't know, and that time you're seeing a patient and remembering the mnemonic. Oh my god, ऐसे होगा, ऐसे होगा, should I cut this first, that. So there comes a difference in the confidence, and a patient will never get operated from a underconfident surgeon. This is the life, and that is why you start getting frustrated. You know, yaar, surgery saturated, surgery saturated. You must have seen everyone talking about surgery being saturated. ऐसा कुछ भी नहीं है. You know, I'm young, I'm not that aged. I have two hospitals. I've made it in a city which is in Delhi. So I don't have any base in Delhi. My parents are from Kanpur, they're from UP, and I settled myself in tier one city, and that in a short span of time. So जो लोग कहते हैं ना कि सैचुरेशन है, काबिलियत है, तो सारे सैचुरेशन को फांद के आगे जाओगे, और काबिलियत नहीं, so you can say a bad workman always blames his tools. This is what is going to happen again and again, and you keep on blaming yourself. So start early and lead the race. This is what is my mantra.
Well said, sir. Sir, you were telling that books cannot replace the lectures. Sorry, lectures cannot replace the books. So, sir, you are telling to start the surgery early in the second half of second year, but many students who have not started surgery that early, they are starting it in their fourth year. Then many of them do not have time, means to study the book. So, what should they do?
Uh, First of all, like, try to understand. We have to uh, enmass the knowledge. Remember, एक word होती है ना, you have to enmass the knowledge. And how can you enmass the knowledge? Try to understand. Have you seen that movie Three Idiots? Oh, Rancho, huh? He used to sit in any class. He used to sit in every class, and from here and from there, he used to get that knowledge. So you skip the surgery postings. बहुत बड़ी चीज है. So when you go to surgery postings and you are willing to learn, the surgeon will always teach you. लेकिन you don't go, and then once upon a time you just jump on the teacher, so वो नहीं पढ़ाएगा. So identify good teachers in your institute, go to them, do a case presentation. That is the only way where you can reduce the learning curve by 1/4. Try to understand. Either you learn you on your own, start early, study well, try to mix the clinics and the texts together, take help of all the resources available near here and there. But if you haven't done till yet, go to the wards, learn from the experience of the others. So someone is giving you a case presentation of CA stomach, they'll tell you, okay, this will be the classical presentation. So now you know a patient of CA stomach lying in front of you, this is the classical early presentation, this is the clinical finding, and today I'll get back and read that case. So remember, common things are repeated, rare things are not repeated. Remember, the first thing to success is you should know the common. बिकॉज वहां जो फुलिशनेस होती है ना, दैट कॉस्ट यू लाइफ ऑल्सो, दैट कॉस्ट यू रैंक ऑल्सो. So start with the common case. Don't miss the word postings. If you see the latest trend of, you can say, exam, I would say in last 5 years, whatever surgery-based questions if you see, or maybe last 10 years also, how many volume number-based questions have you seen? How many Hakataka syndromes have you seen? Lakataka syndrome. Most people are bothered. Now I see a lot of, you can say, online resources telling most common cancer in India, most common cancer in West Bengal, most common cancer in male in India, in female in India, most common. But this doesn't matter. If you see the surgery papers, they are made by surgeons, not by morons. I would say morons. Don't take me otherwise. बच्चे ये जो competitive दुनिया अभी आप देख रहे हो, the education level has gone to an extreme low. First of all, lot of people who are teaching their subjects, they don't know what they are teaching because they don't practice that thing. And someone who's not practicing medicine or who's not practicing surgery, how can they teach that subject? That's the complexity. So that then you land up mugging up most common presentation, most common investigation of choice. Remember, the case differs. Let me share a common experience. 3 days before, I operated a retroperitoneal, you can say, tumor, and before that I did you can say ultrasound, and ultrasound was showing me a complex cystic necrotic lesion. So I went for a CT was showing me a non-enhancing with mild septate enhancement, no lipomatous component. So basically, अगर आप रेट्रोपेरिटोनियम की बात करें तो liposarcoma is one of a very common tumor, so everyone will have a view that okay, it's a liposarcoma. But just see the level of, you can say, introspection I've done in that case. Patient with mild septal enhancement, that's a case maybe suggestive of paraganglioma. अब ये चीज अगर आपने पढ़ी नहीं होगी, so how will you get a metanephrine done? And then you will go on the table, you will operate on the patient. The moment you touch the tumor, the blood pressure will shoot and the patient will die in front of you without your error. And you will be taken to court, you will be sued. Why? Because you never knew anything. So यहाँ पर वो डिफरेंस आता है कि लर्न द बेसिक्स. तो जब आप अपने कॉलेजेस में वार्ड पोस्टिंग्स में जाएंगे, वहां पर वो यही सारी चीजें सिखाते हैं. वहां आप देखो, वो दे डोंट टेल यू द फर्स्ट सर्जन टू डू दिस, सेकंड सर्जन टू डू दिस, द फर्स्ट सिम्टम इज दिस, सेकंड, दे विल टेल यू द बेसिक. This is the presentation complex, this is how we approach. So surgery is all about the mathematics based disciplined approach. Here we don't say 2 plus 2 is 22. Just like in microbiology, if it is, or in biochemistry, if you have a mousy odor from urine, so you'll have a mousy odor. You will not retrospect कि क्यों है mousy odor, fish like odor है तो क्यों है. But in surgery it's not like that. If there is you can say presentation, we have the reason behind that, everything. So that is why surgery is very precise. And if you are a final year subject, आपको लगता है यार सेकंड ईयर तो हमने उड़ा दिया मौज मस्ती करने में, so बच्चे start from the wards. जो भी केसेस वहां पर डिस्कस होते हैं, jot them down. ऐसा नहीं कि आज मैंने पढ़ा और मैं भूल गया. Jot them down in a diary. Whatever case is discussed, go back, open your books, fill up the blanks. कि ठीक है, ये आज मैंने सीए ब्रेस्ट का केस देखा, so I remember the CA breast staging, I'll remember the CA breast approach, I'll remember the triple assessment, I'll remember the management, or I'll create my own notes so that I can revise it again and again. And this is how you'll master in everything. So यही एक तरीका है कि फाइनल ईयर में आप अच्छे से you can excel your things, because half of your efforts and half of the efforts of the consultants who are going to help you with this.
Thank you, sir. So we all know.
Yeah.
Okay, sir. So we all know that wards and internship, they are very important for surgery. So, sir, according to you, how will we utilize them?
Let me tell you. So when we talk about wards and when we talk about the internship, first of all, in wards you don't get to access emergency. So wards are the time where you learn about cold cases, and especially when you talk about yourself, लाइक एमबीबीएस स्टूडेंट्स, उनको सबसे ज्यादा क्या जरूरत होती है? उनको सबसे ज्यादा जरूरत है अप्रोच टू एसओएच. So how to approach a swelling, how to approach a lump, how to approach intestinal obstruction, how to approach, you can say, the basic standard cases like thyroid breast. If you have a base of thyroid breast made in the ward, it will be very easy to learn them when you read the textbook. आप क्या करते हो? टेक्स्ट बुक पढ़ते हो, वार्ड करते नहीं हो, you go for an exam and then you are confused. So surgery is all about practicing. If you practice that thing, you learn that thing, you will excel. Otherwise बच्चे आप घूमते रहोगे. So what will tell you about the cold cases? Now when you come to internship, now when you talk about surgery, the best part to learn surgery is either the OT or the emergency. So in the emergency, you get the first approach to the trauma, and everyone will agree to this. हर एग्जाम में 7 से 8 क्वेश्चन ट्रॉमा के आते हैं. Why they don't want to test my knowledge? They want to test your knowledge. People say नहीं, से trauma important. Trauma क्यों नहीं important होगा? They are they are organizing a competitive exam for you guys. And remember, when they are organizing a competitive exam for you guys, they know that what you have been exposed to. So trauma is the part, burn is the part which you access in the emergency. Obstructions you get in the emergency. Bleedings you get in the emergency. बहुत सारे बच्चे कहते हैं कि सर आप बड़ा अनकन्वेंशनल वे में पढ़ाते हो. आई स्टार्ट द जीआईटी विद जीआई ब्लीड एंड द नेक्स्ट चैप्टर इज इंटेस्टिनल ऑब्स्ट्रक्शन. Study the subject as a subject comes to you. The patient will come to me with bleeding. So it may be esophageal, it may be a gastric cause, it may be a portal hypertension. There I will summarize this and everything. So try to make that learning associative learning. When you get a patient in emergency, so suppose you get a retroperitoneal injury, or suppose you get a intestinal injury, you get a liver trauma, उसको वहीं पर पढ़ो जरूर. So once you settle the, इसका मतलब ये नहीं कि once a patient comes, you start opening the notes and patient is dying, Dr. Babu, bachinin, and you are just busy learning. No, the first is stabilize that patient. Now you have that freedom of having the resources available on your phone. अपने फोन में पढ़ो, देखो क्या important चीजें होती हैं और उनको वहां देखो. So remember, you have that associative memory, you have that memory that you practice on that patient, and that creates an impact. Are you getting me? So छोटे जब हम when we were kids, there was a subject which was known as moral science. So moral science में last में एक moral बताते थे. The moral of the story is united we stand, divided we fall. But to explain that moral, they created that 10-minute story which you were forced to read. Do you know why? This is known as the power of association. फिर वो अगली बार याद रहेगी कि there was a swarm of birds and one of them separated in hunt of that, and then he got caught by that poacher. So moral of the story is stay with your friends. So ये समझो इस चीज को. So next time when you get the patients in emergency, do assess them. Do see what is written in my books and can I get it in my, and try to catch hold of third year PGT. फर्स्ट ईयर वाले से कोई फायदा नहीं होगा, उसको बेचारे को कुछ नहीं आता है और ही स्ट्रगलिंग विद हिज लाइफ एंड स्लीप. So try to catch hold of third year PG who are ready to teach you also and who are loaded with the knowledge. The maximum knowledge is available with third year PG because उसके बाद again you are stuck in that cycle. So वो आपको कुछ अच्छी चीजें बताएगा, उससे केस डिस्कस करोगे, so you will hurt his ego. That an intern is asking me a question, trying to explain me something, and in that retrospective, you can say rebound to that ego. He will tell you, okay, you know, you are talking about this liver trauma. Do you know about this uh, concept of packing? Do you know damage control surgery? And then that is what you wanted. You wanted to provoke his ego. And now in that provocation, he taught you 2-3 things. So आ गया ना वो रैंचो कॉन्सेप्ट, आपने उसे प्रोवोक किया और उसने फिर वाह आपको वो 2-3 चीजें दी, आपने नोट कर ली. So this is how you get access to the best available resources in free and in purest form.
Thank you, sir. So many students, they are now in their internship or they are post interns. So for them, what would you suggest? I mean, how they can revise the surgery for the competitive exams?
When we talk about the interns and the post interns, now you know that exam to dena hi dena until up till the day the next is declared. Let us presume that this is the system which shall be going on. So first of all, you have to decide हाउ मच क्वांटम ऑफ योर डे यू आर डिवोटिंग टू स्टडी. आपने डिसाइड करना है कि जी मैं 5 घंटे देने हैं कि 10 घंटे, वो एंड बियॉन्ड दैट ऑल दोस थिंग्स आर hypothetical. आप कहते नहीं जी I will study 20 hours a day, बच्चे नहीं, your brain will not be able to concentrate beyond 10 hours, 10 effective hours. So if you decide that 10 hours a day, follow the 70-30 rule. What is the 70-30 rule? 70% of your dedicated time should go in reading theory, and 30% of that time should go in solving MCQs. Why? Because now you don't have to write the answer, you have to write the explanation to that answer. Okay, it's option A, it's option B, it's option C, or option D. So they have the explanation, you have to match that thing. So 30% of the time should go in solving MCQs. Now 70% of the time that you have, you should again have a split of 1:2. Now you will say, sir, what is 1:2? Remember, 70% of the time you have dedicated for theory. Suppose you decide that I will study for 8 hours. Of this, 5.5 hours of mine will be going to the theory part, and remaining 2.5 hours will be going to lecture, to this, what you say, MCQs. अब ये जो 5-5.5 घंटे, दैट शुड बी डिवाइडेड एज 1:2. व्हाट इज 1:2? 1 मेजर सब्जेक्ट, 2 माइनर सब्जेक्ट्स. जब तक नेक्स्ट नहीं आ रहा है, ये मान के चलना है, 1 मेजर सब्जेक्ट, 2 माइनर सब्जेक्ट्स. So now 70% of that time should be devoted, again 70% of that time should be devoted to study 1 major subject, and 30% of that time should be devoted to read 2 minor subjects. Remember to be a fast reader. So suppose 5 hours you have, 4 hours you will study the main subjects. You decided, okay, I'll be completing medicine, so you'll be studying medicine. And then you decided, okay, short subjects, I will pick up one dermatology for 30 minutes and 30 minutes radiology. Once the timer clocks 30, stop dermatology or stop whatever short subject you are and switch to the other. But in this way, your brain is getting adapted to the multiple subject based, you can say, approach. Because when you're going for exam, you don't get all the questions from medicine, all the questions from surgery. So first of all, you're doing a lot of twisting. कि यार मैं एक दिन में आई एम स्टडिंग अ मेजर सब्जेक्ट ऑल्सो, आई एम स्टडिंग 2 minor subject also. First of all, you learn this. The second thing is that the short subjects, the beauty that they have, they're really very short. The first reading might take maybe 6 hours to complete cumulative, I'm talking. The second reading might take only you can say 3 or 4 hours to revise them. And when you're going for exam, ऐसा आएगा कि in 30 minutes you can revise the entire subject. So this way, you are just consolidating, zipping off all the large, you can say, short subjects into a very short span of time, without having to worry about कि मैंने anesthesia तो पढ़ी नहीं, मैंने psychiatry तो पढ़ी नहीं, dermatology तो पढ़ी नहीं, या orthopedics तो पढ़ी नहीं. So remember, major subject should be given that respected time, क्योंकि इनमें concept building बहुत जरूरी है. So whatever videos you are looking, whatever text you are reading, वो आपका 70-30 split में होना चाहिए, and 2:1. That's 1 major to 2. Again, the next thing is, what you all do a mistake is, आज मैंने esophagus पढ़ा और शाम को मैंने दंदनाता हुआ esophagus के 200 MCQs I solved. Now when you solve 200 MCQs of esophagus, you get a pseudo boost. My God, I'm great, I'm GOAT, greatest of all time. सारे सही हो रहे, बच्चे होंगे ही होंगे. And if you ask me, sir, what is the probability of me getting selected, I would say only 10%. You are doing a wrong exercise. Today, if you study, suppose, a subject surgery, and you are studying, suppose, esophagus, अगले हफ्ते solve the MCQs, or maybe at least 5 days gap. You need to get some time to settle down. Suppose if you are pouring a cold drink into a glass, there will be a time when the liquid is less, but the effervescence is very high. है ना? So total gas, and you are getting, you can say, a belief that, okay, I have this glass full. Wait for 10 seconds, and then you see it's only 40% of the glass which is full, and 60% to gas हो गया हवा. समझे कि नहीं? So slowly and slowly pour your knowledge, and then taste it, or test it. Are you getting me? So बच्चे, ये बड़ा important concept है कि take 1 major, 2 minor subjects. The second thing that you have